6 panelists, 6 guests who are going to be talking about 5 particular topics which are difficult, which are uncomfortable, which make us a little bit uneasy. And the format of the session is quite simple. We'll have our guests responding to a few questions, and then we're going to go to you, the audience, and ask you to really reflect on these topics that we've been talking about. And then depending on the discussion, we can widen to some other issues which are particularly uncomfortable and in relation to discrimination and neglect in WASH. And just to let you all know that we're recording this session, and it's actually being live streamed by Hero, who is a hero with a Hero camera, on the WSSCC website. Oh, and the WSSCC Facebook page. So just to emphasize, this session is really intended to be a conversation between everybody here. And let's see who else comes in, but I'll probably invite you to come a little bit closer so we can have a little bit more of an intimate conversation. And we want to enable some reflection and exchange on what can be done to really address some of these difficult issues around discrimination and neglect in WASH. So I ask you just to be frank and honest, and of course, I don't have to say respectful because we all are. Just expanding a bit on the title of discrimination. What is discrimination? And this is from the UN Convention on the Rights of Persons with Disabilities. That discrimination is any distinction, exclusion, or restriction which has the purpose or the effect of impairing or nullifying recognition, enjoyment, or exercise on an equal basis of all human rights and fundamental freedoms. And within the UN gender guidance, it's pointed out that discrimination and subordination really persist in society and globally because powerful groups benefit from it and act to maintain that position of privilege. And then maybe that's something we can reflect on as we talk today. And what's neglect? It's not a word that we use much within WASH. But neglect, it's a form of abuse where the perpetrator, who is responsible for caring for someone that is unable to really care for themselves, fails to do that. So it's about responsibility and duty of care. And neglect can be a result of carelessness, indifference, and unwillingness. So that's from Wikipedia, which has it's a little bit easier definition to get into your head than the first one, but quite important, I think, as we start our uncomfortable conversation. So we have 6 guests on 5 topics, and this session has been organised by 7 organisations from the Swiss Water Partnership, and it's been a long process, started by Soraya Kohler. So we've really been talking over many months about this session and what we could do, how we could do it. So I'm very happy to be moderating today. So I'd like to invite our first guest, and since we're so few and the acoustics, well, they're kind of great because you don't hear anything, I'd like those of you who are here to clap really loudly for our first guest, and that's John Brogan from Terre des Hommes. Welcome, John. And John's going to be talking about WASH in penal institutions, about WASH in prisons, possibly a topic that many of us have never even thought of. So welcome.
Thank you.
Our second guest is Lucie Leclerc from the Swiss Wash and Sanitation Consortium. Welcome, Lucie. Our third guest, who'll be talking on the same topic as Lucie on menstrual hygiene, is Shivani Swami from Living Guard Technologies in India. Welcome. You're doing really well with the clapping, that's great. Yeah, keep up that enthusiasm for the whole session, please. Our fourth guest is Caroline van der Verden from WSSCC. That's the Water and Sanitation Collaborative Council. Welcome. The Swiss Aquatic Research Centre, which is also known as Eawag.
Thank you.
Welcome. And finally, Nadia Benani from the Swiss Agency for Development and Cooperation, SDC.
Hello.
Hi, morning. Great. Right, I'm going to start with you, John. Ah, that's a good idea, the mic.
Technology.
Yeah. You're all wired up. Really wired up. I feel like I'm a hospital patient with all these things. Right, John. Penal institutions. That's not a topic that we hear about in WASH. Why on earth is that important? Can you tell?
Sure, thank you. Well, my organization, Terre, we work in child protection, and we take that off.
Do you want some help?
Thanks.
Yeah.
That was uncomfortable now.
Yeah, it can be even more uncomfortable, don't worry.
So our work takes us into prisons and into detention centers where we see grossly inadequate WASH infrastructures. These conditions are negatively impacting the health and well-being of not only prison population, but also the prison staff. And, you know, this is something which, if you want to transform the situation in a prison, it has a lot of challenges to get to the level where you're really respecting human rights and dignity. And this is especially true in contexts like low and middle income countries, when most of the population living around a prison doesn't benefit from adequate WASH services. So here we're talking about a significant population of people globally living in prisons, more than 11 million people. And over half of those people are living in, more than half of them are living in low and middle income countries. So one thing we're seeing is a rising trend. There's an increase in prison populations. In South America, since 2000, the population has tripled. In Southeast Asia, the population has more than doubled. So in this SDG era of universal access to WASH, WHO and UNICEF have defined universal as WASH access even outside of hospital settings. And they've done a lot of great work on healthcare facilities and schools with standards, monitoring processes. And this has led to a lot of forward momentum for WASH in healthcare facilities and WASH in schools. Prisons should not be left out of this.
Thank you very much, John. I mean, maybe you can kind of enlighten us more about what we know and what we don't know. I mean, I've never been into a prison. I thought I was going to go to prison once when I was in northern Nigeria, but that's another story. But, what do we know and what do we not know about the situation in prisons?
Well, we don't know a lot because there haven't been a lot of studies done. Not a lot of research has been done into this topic, and even less research in low and middle income countries. The University of North Carolina, the Water Institute, last year they led the very first ever systematic scoping review of environmental health conditions in prisons. And while the findings that they had were based on only 80 studies that they could find since 1960, which actually qualified as investigating environmental health conditions and with peer review and original data. And only 20 of those were in low and middle income countries. So despite that, what they found about the conditions in the prisons is similar to what we're seeing in the field. The very big risks for health, like the overcrowding, the poor sanitation conditions, inadequate waste management. I think the number one risk was contamination via food contamination from the kitchen. So this is a big problem, but what we don't know and what the research didn't find and what we would really like an answer for is what are the underlying reasons for these situations in these prisons? How is the prison system itself influencing the health of its prisons? There were no studies on the particular needs of women, of children, and people living with disabilities. So, there's a lot to be done not only on the monitoring side, but also on the research side to find out more what's happening in the prison system, what's happening there.
And is it easy to get access to find out? I mean, is that a problem to access prisons, to do that research? How easy is that?
It's very difficult.
Yeah.
Even for us to go in and access the prisons, it's a very sensitive area, it's a sensitive population. To get access, you really have to show an added value to the administration a lot of times what can open doors is to do some infrastructure to support that. And when the infrastructure happens and there's a positive effect not only in the prison system and the population, but also with the staff, then we can get a little bit more access to the prisoners to understand the context. But it can take years to build up that kind of trust. So I think for researchers, it is a big challenge.
Great, gosh. Thank you very much. A big round of applause, please, for John bringing a completely new topic, I think, for us today. So, yeah. I'm going to go to a topic now with Lucy and Shivani. Now, this is a topic which was new about 15 years ago, and I remember I was in Uganda at the WEDIC conference, and a man, he was a gentleman, talked about menstruation. What? He actually talked about the problem of menstruation on the stage, and a few years later in Cairo there was a woman who also talked about realities in schools of dealing with managing menstruation. We've heard the word a lot here. It's less of a taboo for us, but certainly still a taboo topic for many, many people. So let's come to you, Lucy. How does menstrual hygiene management really relate to WASH? What's the link with WASH and menstrual hygiene management? Can you tell us that, just to kind of get us on the same field? Yeah.
Thank you, Kristen. I think you're right. There is so much neglect, discrimination, and taboo about menstruation. Myself, I never thought I would ever sit on a sofa and be facing a crowd and talk about menstruation. I think I can give some examples. There are many countries in Africa where women, when they are menstruating, are still considered to be unclean, are not allowed to touch water, not allowed to cook, are even discriminated from some religious ceremonies. In school also, in particular, this is a major problem. WASH facilities are not always equipped with the proper facilities for adequate menstrual management. Even worse, there is not often information and knowledge, information passed to children around what are menstruation and how to manage it. You end up having girls who are menstruating, like young girls at primary school, who don't know what's happening to them when they start bleeding, who get scared, who first think that they might have some serious sickness, get scared to be bullied by their classmates. Then because of this, they end up missing schools when this happens. And actually, you can see in statistics that at this age, it's also the peak where school dropout is happening.
There's a PowerPoint kind of slide running, a film running in the back all the time, and one of the pictures that will come up is of a particular menstrual hygiene management product. But this will run many times, so don't feel you'll miss it. You can see it again, it will come back. But that takes me to you, Shivani, if you could pass the microphone. You've been really developing products for menstrual hygiene management in India. Can you tell us more about what you've been doing?
Sure. So Living Guard Technologies is a Swiss-based health sciences company, and we found a way to combine or permanently bind antimicrobials with various substrates, so be it paper, textiles, plastics. And as part of this entire exercise, we developed these gravity-driven drinking water purifiers, and we went into rural schools and institutions in India where there was a problem of electricity, problem of water access, and we actually started working on drinking water. And as part of the entire monitoring and evaluation side of things, we saw that still there was a tendency for girls and women to lose out on school attendance or going into work. And when we delved kind of deeper into it, we saw that there was a direct linkage between menstrual hygiene management and their ability to effectively enter the workforce or continue their education. And given our technology, we started actually working in the rural areas to create products that address their needs. And so Sofkins are a line of antibacterial, reusable, washable period panties and sanitary pads that have been created, in the rural setting. Specifically, the version we have that is a period panty that was created because many Indian women still don't wear underwear or have or are able to afford underwear. And it's been a lesson. It's been about 3.5 years now, and we also partnered up with this social initiative called Give Her 5, where we're crowdfunding and raising funds to kind of provide women who can't even afford yes, the reusable product, access to menstrual hygiene management awareness, as well as the product and continued access. And we've done projects in prisons, and we've done, and it's amazing that you talk about how difficult it is, because we actually got some backlash from, people who follow us on social media saying, these aren't needy people, why are you, providing the funds that you've raised towards helping women in the prison systems. But I visited one of the prisons in Mumbai, and you could see that there's overcrowding. You have women who have children, and the children are allowed to stay within the prisons till the age of 5. And they're all in one room, and there's no kind of segregation of clear spaces for where they have to eat, where they live, the toilets, and no access to soap, no access to disposal systems for menstrual products. So it becomes very difficult for people to manage.
Oh, thank you very much. Yeah. When you think about women being able to buy underwear, and think of the prisons, it's horrendous. I want to come back to Lucy. On menstrual hygiene, you talked a little bit about menstrual hygiene management in schools, and is this just a girls' issue, or is this also an issue for boys? I mean, is it just a female issue? Or tell us a bit more.
But this is a good question. I think we tend to think that menstrual hygiene, you should discuss it only with girls, but actually you should also sensitize boys so that they don't make fun of the girls. They also support their fellow girls at school and their daughter and their mother, so they understand this a bit better. So in the Swiss Water Sanitation Consortium, so this is a consortium of 8 Swiss NGOs implementing 10 projects in different countries on wash projects. We've been focusing in schools since 2011. We've developed recently the Blue Schools Kit, which is a kit that aims to support schools to become healthy and environmentally friendly. So that sounds like a big topic. But where I want to come is that one of the topics of this Blue Schools Kit is on menstrual hygiene management. Actually, we call this topic growth and change, because we found it important not only to focus on menstrual hygiene management, but also to look at the topic also from a more gender perspective, discuss the different role associated with the 2 genders, and then after come to body changes that happens in both girls and boys at puberty time. So some of the material I have brought them here, So in the Blue Schools Kit, there are different practical exercises. Maybe you can, or maybe this. I mean, John is also one of the authors of the Blue Schools Kit, so he knows it very well also. So we've developed basically 2 catalogs, one for low-cost technologies linked to menstrual hygiene management, and one with practical exercise that you can do with both boys and girls relating to menstrual hygiene and gender. So like this is an example of the role reversal game that you can do with children. Then after here you have an exercise a game that we call knock down the myths, when you ask boys and girls to write on a piece of paper preconception of myths. With my French accent, the word myth is very hard. So sorry.
You're doing superb.
They write what they think is menstruation, or all kind of false idea they might have, or ideas they might have. They write it on a piece of paper, put it in a bottle, and then all together with a ball, they just knock down the myth. Then a discussion with the body change, and we have those big cards of men and women. Discussion around the menstrual cycle, how to keep the menstrual cycle. Sorry, John. Also, we encourage schools to form, if appropriate to the context, girls' club to make different kind of pads. We also present different options. So Shivani showed us one of the technical options. When you work for NGOs, it's important not to impose one technology, but to present a range of options and let the school see what fits them best, also based on the market and the availability in the country. And also have a discussion on the disposal. So it's like also the sanitation system. It's important to look at the whole cycle on menstruation, not only the use, but also the disposal and the treatment. So I'm very excited about this Blue School kit. So is John. So if you have more questions, we are very happy to talk about it after the session.
Thank you very much. Thank you to both. You want to add something? I see your hands.
Oh no, I was passing them.
Ah, okay. Okay, we'll come back. But a round of applause, please. And this will be a conversation. So please, if you have questions, ideas, reflections, things that you want to add, just keep them noted. We'll hear from all our panel, but please, yeah, keep a note of what you want to talk about. We will come to the audience. We have time for that. Caroline, uncomfortable conversation from WSSEC. I mean, you've invested through your Global Sanitation Fund heavily in behaviour change and trying to change people's behaviour, particularly with this kind of the community-led total sanitation approach. But how inclusive is CLTS? And are there any uncomfortable neglect, discrimination issues that you could perhaps share with us?
Thanks, Kirsten. Yeah, I would say it's not as inclusive as we'd like to think. When WSSC started funding, when you know, it's really been going for 15 years at sort of the level that CLTS is being applied now by many different organizations across many different countries, that with that comes also a big difference in the quality, if you like, of the type of CLTS that is being done. Obviously, the idea of community-led total sanitation is that this is an approach that brings the entire community together around the decision to clean up, change their behaviors, start using toilets. But if you dig a little bit deeper, bringing the entire community together might not really happen all the time. And so WSSC commissioned a study in 2016-17 to really look at how our programs, or the programs we were supporting, were doing around equality and non-discrimination. And found quite a few instances where people were excluded, where things got uncomfortable. So, for example, mental health issues. So, if you look at the statistics, there's actually a lot of people with mental health conditions around the world, but also in the countries where our programs are active. Often the times those people trying to get someone who isn't fully in command of their mental capacity to change behavior can be very, very hard. And so what happens is that, you know, they get treated quite badly sometimes to try and get them to go with the decision of the community to change behaviors. And so, for example, we found with the researchers that went in, we found one case, and we know there's more, but this was one particular example where this community had someone, a grown man in their midst who had mental health issues, and who was basically doing his business wherever, whenever, which meant that they felt this wasn't going to help them getting their ODF declaration. And so for the time that they knew that the certifiers would come, they banned him from the village, literally for about a week. And then when the certifiers had come, they said, okay, now you can come back. Another issue we found, for example, in Nepal, and that also happens in other places, was where the community takes a decision that everybody needs to construct latrines, but there is also a minimum standard on what kind of latrines there should be. Not everybody can afford that. And so there were also cases where people were basically forced to take out loans to construct the latrines, but then weren't able to pay back those loans. And so, for example, an elderly man who lost his land and his home because they repositioned it because he couldn't pay back the loan he had to take out to build the toilet that the community wanted him to build as part of the CLTS process. So we found those kinds of situations, which obviously is shocking to find.
Yes.
We weren't, you know, we did the study because we wanted to know. We found that. We also found, to be fair, very positive examples where people have been helped. But yes, we did find quite bad discriminatory practices.
Well, thanks for sharing that with us, and I think it's a real testament to what you're doing, because in the development world we really love to tell success stories, and we're not so good at sharing the things that are going wrong or that are uncomfortable. So thanks a lot for sharing that. And you know, following up, what are you doing? So you found these examples, and you may have found some systemic problems. What are you doing to address that?
So we've been doing quite a lot over the last couple of years. I think a lot starts from making sure that the CLTS facilitates and people really leading this or facilitating these processes in community are more aware about difference, about vulnerability and disadvantage, even within these communities. And even if they come themselves from that area, they might not always be aware of their own preconceptions either. And so especially around discrimination of certain ethnic groups, for example, different facilitators themselves are from those areas as well. They might actually, maybe somewhat unknowingly or unconsciously perpetuate biases themselves. And so they might not even be aware that when they call for a triggering event, there are certain people not ever being invited or not actually ever being supported to really attend. So a lot of it starts from training CLTS facilitators to make them more aware and to set up a couple of principles. So one very important one for us is nothing about us without us, which I found a very powerful concept to think about it. And so that's also, if you think, for example, about people with disabilities, people living with disabilities, or other people who might not have necessarily always been asked themselves what they think of something or what they would like. Elderly people sometimes also just get, a situation gets created for them. So to be more conscious about inviting people to share, their perspective, their needs, their wants. And the concept of do no harm, and that's come up in a number of other sessions this week as well, which we really feel is a very important starting point. Be aware of the harm you can do. And then once you've, sort of have more of these basic concepts, more in your mind, then a lot of this is about identification. So how do you identify the people that are more likely or more at risk of being either neglected or discriminated or left behind or that are particularly vulnerable? How do you identify them? What do you need to look out for? So we've got systems for that. And then once you know that, what can you do to try and bring them along? And how can you work with the community to make the community more aware what they can do to bring these people along and why it's important for them to do that. So one thing we did, this is summarizing all of that in a new handbook on EQMD for CLTS facilitators, which we've launched this week, so little plug. And with that is a training as well. So at the moment we are going around and training all the GSF programs, but we're making this available to anybody who wants it. But it's really about little things you can do, and that's the other thing, maybe the important thing to say. We've had a lot of discussions, even internally, early on, about if you want to take an equality and non-discrimination perspective, that's going to cost a lot of extra money. And it doesn't necessarily, because a lot of this is about taking a different starting point, being more aware of these issues. When you begin a process, you identify people early on who may probably need additional, attention or support. You can do things that don't necessarily cost extra money. In fact, it might be more cost effective in the end, because we know that there are cases where communities weren't reaching their ODF status, often because there were particular issues getting groups that were in a particular vulnerable situation to be able to access and use toilets.
No, thank you very much, and also answering the question that was in my head. Thanks a lot, and let's have a round of applause for Caroline. Just keep kind of noting your question, because we really want to hear from all of you, even those at the back, which I can hardly see with the light. So if you have a question, make sure that you stand up and wave, Vasco. We're going to stay on the subject of sanitation, but move to the issue of shared sanitation, which you've been doing a lot of research on. What's the importance of doing research on shared sanitation? Enlighten us, please.
Okay, thank you. Actually, we're still doing research, so we haven't finished yet. So maybe I'm going to start with urbanization. So as we know by now, more than 50% of the world's population are living in cities, and cities are usually not, they cannot take up these masses of people that come into the cities. So a lot of them end up in low-income settlements, slums, and often informal settlements. And these people usually are very poor, so we have high poverty levels, and coupled with high density, the people in these settlements, they can neither afford nor build, because of the lack of space, individual household toilets. So the only solution that is left is shared sanitation. Shared sanitation can have many forms. There is basically categorization is lacking, so we don't have one yet, like an agreed on categorization. So shared sanitation can be sanitation facility that is shared between 2 or 3 households, between 20 households. There are also some community toilets. and up to public toilets where you pay basically per use. And shared sanitation is currently within the SDGs not accepted as a basic solution, because there is an indicator list also lacking that allows you to monitor and assess the quality of shared sanitation facilities. And so that's what we're working on. We're trying to establish an indicator list that allows us to evaluate, assess and monitor shared sanitation, the quality of shared sanitation facilities, and with this then also to create a rationale to take it up within the SDG framework.
That's interesting. I mean, you say at international level it's not considered improved. What about at country level? I mean, do countries recognise shared sanitation?
I think there are a few that do, basically some investments, but in general, it's also because a lot of these low-income settlements are informal settlements. The public authorities, the governments, they do not invest in these settlements, because by investing in these settlements, they will kind of legalize the status of the people that are living there. So this kind of prevents any investments from public authorities. And on the other hand, because it is not accepted as a basic solution within the SDGs, also NGOs, they do not invest in these kind of solutions, because you don't see any progress, and also NGOs, they depend on statistics, so to show what they have achieved with their investments, and by not having a framework that allows to assess and evaluate progress, investments are not being made in these solutions.
So you're kind of arguing that the measurement is excluding this type of service which people use and need. Yeah.
Exactly.
Yeah. No. Very interesting. Thank you. We're going to hear more from you, I think, later. So a big round of applause, please, for Vasco. Nadia, you've been patiently waiting, and I'm very close to you. I'm going to come just back a little bit so that... Lissy, could you help me move this slightly back, just so I don't block the audience from seeing Nadia? That's wonderful. Thank you very much. Great, that's better. I was a bit uncomfortable that you wouldn't be seen, which is super important. So last but not least, coming to Nadia from SDC, can you, looking at this from the kind of the bilateral donor funding perspective, why do you think it's important that we have this uncomfortable conversation about neglect and discrimination in WASH? Why is it important for you?
I think it's important because it works, having this kind of conversation. I mean, as Lucy was mentioning, a few years ago we would never hear the word menstruation in the mouth of a grey hair guy wearing a tie and sitting in an important position. And now it works, so we see that speaking about it really works and pushed also different stakeholders and in the country in looking at what's going on. We always spoke about water. There has been a big fight about having then an indicator, changing the MDGs so that sanitation is on board, and now it's there. It has its dedicated goals and indicators, etc. So having this conversation, it's working. And I think it's also about, like, from a donor perspective, it's also looking at the bigger picture. Maybe the fact that there was a long theory of having this trickling down economy, so invest at bigger scale and then people will catch up. Those left behind will be taken by the wave of prosperity and etc. And it just simply doesn't work. I think for the donor community it's also important to be aware of that and go back to very specifically targeting those the most vulnerable. Speaking about the issue, also on the menstrual hygiene, we work a lot also through the humanitarian aid on some intervention in camps on displaced person about how do you do when you fleeing your house and you threaten and you're scared and you have your period. you're running away from Syria, holding your child, crossing the line, etc., and you're just bleeding in the middle of the way. So these are really issues that it's not on the paper, it's reality. And I think a lot of our partners really came at the table with some very clear pictures saying, what does it mean when you don't have access to proper way of managing your menstruation? What does it mean? But the fact that you go to the detail explores, meaning that you put clay in your underwear, that you try to find leaves that are kind of more absorbing than others, and then you have infection and etc. Like never, no one spoke about these issues. So when you don't speak about it, you don't tackle it. Maybe also in terms of zooming out, I'm sometimes a little bit uncomfortable with the term of leave no one behind. In sanitation, half of the population doesn't have access to toilets. So we had the whole exercise in SDC about how each theme appropriates the topic of water and sanitation. So we were asked to say, okay, so who do you want to target, etc. I was like, I don't know, we're targeting half of the population of the world. I mean, why do we still, does it really help having this leave no one behind when we have this magnitude of person still not accessing clean water and sanitation? So we need to engage also at national level, at global level, in terms of pushing the agenda about this. So I think once again, having figures, investigating on what's happening, and really looking at digging on special groups in jail, etc., it's part of the big picture. And I think the dialogue that you have at national country is really important on pushing on the needs and what is the value of having your population, healthy. What are the faults in your system, and bring in this dialogue also like the most vulnerable groups.
No, thank you. And that's a question I think to the audience, the usefulness of this term leave no one behind also to you. So that'd be something we'd like to hear from. Thank you. I mean, just coming back to SDC specifically,
yes.
What are you doing to address inequalities and equity? Tell us about your strategy. I mean, how are you trying to deal with these issues?
Okay. So we looked at who there are many actors working on the issue. So of course we have some partners we work with, and many of them are sitting on the sofa today. But we look at partners that can really bring. We have this bilateral cooperation. So in some countries, having the dialogue with the authorities, with regional government, with the communities in terms of engaging and looking at the added value of tackling the issue of water sanitation as a basis for further building on any other kind of goal that you want to reach. You won't have proper education if you don't have water, if you don't know how to manage, like the whole sanitation system. You won't have food security if you don't have proper access to water. You won't have peace if you don't manage your water. So our strategy is to partner with different actors in the sector, and really to think about like the transformative approach. How can you accelerate the fact that like the numbers of people reaching? And we worked a lot with the private sector, so we're pushing through other actors on developing the entrepreneurship culture, the socio-entrepreneurship, because when you read in Nigeria that in the national review, I think access to sanitation in 0.4% in rural area. you need some other actors and not just having this dialogue with the government and saying, you know, it's important, but look at how each actors can play a role. And we were happy to see in Togo we bumped into an entrepreneur who benefited from training at Eawag, and he had the brilliant idea going back home to install some private toilet in the public toilet, in the market, so people would pay a few cents to go to the toilet, and then he learned that, you know, when you get back the urine, leaving it a month, and then you can reuse it, and he started selling then the urine to the vegetable farmers, and he's making quite a lot of money about his business. And so you need to also work with different actors. I don't think limiting yourself to telling the government that it's important will work by 2030.
Thank you. Thank you very much. Big round of applause, please. Can you hang on to the mic?
Yes.
We'll be coming. Yeah, that's great. Thank you. Okay, I'm just going to give you half a minute just if you want to prepare questions, ideas, and then we'll come to you. And I can also have a drink, which is very nice. And I promise you it's not whiskey despite my accent. So. Right, we want to hear your perspectives. So I want to make sure that we really have, I can't hear myself, but that means I can't hear, oh, this is not good, this is not good, this is uncomfortable because this is tucked into my leggings, so I'm going to just try and figure out how to. Can you switch off the live streaming, please, Hero? Oh. This is not a good moment. Oh, I can hear myself now. That's even worse, actually. Right. Okay. Right. Doesn't matter. Okay, from the audience, who'd like to respond to any of these super interesting topics? And if we can stay on the topic first and then we'll broaden out later, that would be great. So I see a few hands, oh, loads of hands, that's fantastic. Lizzie, our wonderful support here, is going to go to this lovely lady sitting at the front, please.
I was just wondering how common it is for women to have their children with them in prison. That's not something that I'd been familiar with or heard about before. And more of a comment to your point about this leaving no one behind, and I thought that was an interesting question. And for me, I think it's useful in terms of signaling to policymakers and donors to not depend on this trickle-down effect, right? I think leave no one behind is a signal to start with the toughest to reach first rather than the low-hanging fruit, as it were. I think there's been a lot of conversation about the SDGs and national data kind of sugarcoating some subnational problem areas. So that's something that we've looked at in our work a little bit more, is to really drill down to the subnational areas where, you know, maybe at the country level the picture looks good for the SDG target, but in some subnational districts there's a lot of heterogeneity in the data. So I think Leave No One Behind may help sort of start with those areas first.
Thank you very much. What a great phrase, sugar coating national data. I love that. I love that phrase. Gentleman here, please.
Thank you and very good morning. My name is Dibalok. I come from DSK and working in Bangladesh. It is very interesting to listen to all the presenters, and some of them I know personally. Um, First of all, about the uh, hygiene situation in prisons. Actually, I didn't work there, but I was a prisoner long back, and I understand what is the situation there in Bangladeshi jail. So, very much appreciated that you have taken up this issue for research and for further improvement in those situations. But in relation to uh, sanitation in slums and having toilets there, actually this is an ongoing debate in our country with SDGs and with even organization to recognize toilets in slums as improved situation. Because we are comparing the situation between open defecation, then fixed place of defecation, and then further improvement in toilet structures. So, that is a constant urge by the government of Bangladesh, along with civil society, to include this as improvement in sanitation situation. And also, just I mean, I like to little disagree with your comment that NGOs do not take that risk to install toilets in slums which may not be recognized or unrecognized. Even last month, a major project done by us was evicted by the government of Bangladesh in Dhaka city. So we do take risks. We know these are risky projects. I'm more than 30 years in this business, and I have faced many of these situations. We protest. We are very sad with that, and then again we start. We cannot leave these communities. The overall slogan of this conference is leave no one behind. So that leave no one behind as NGO worker comes for me for last 30 years. So this is another thing is what I like to mention about rise of inequalities, and while in our countries and especially in South Asia, and rise of populist regimes across the world. Even we see in India, we see in the United States, we see in the United Kingdom, across Western Europe, etc. That means, that translates that I mean, social services and investment for social services are getting cut down. So that is the result of this populist regime's politics. So I think there we are now, I mean, seeking a solution through private sector engagement. But I would love to see that what is the global investment of the private sector to improve water supply sanitation situation in different countries. Because as we know, it is a common sense, that is the last sentence, there is a common sense that more than 96% of the investment in wash is done by the governments. Thank you very much.
Thank you very, very much. And the GLASS report has some very interesting information about investment, and including investment from households themselves, so that's definitely worth looking at. I'd like to come to the lady here, and then we're going to work back across. Yeah, thank you.
Thanks, yes, sorry. Uncomfortable listening to yourself.
Can you just...
I'm Esther de Vrede from Simavi. We also work a lot on menstruation. I just want to mention one thing, that we often assume that girls miss out on schools because of their menstruation, but the evidence to support that is often lacking. We're doing a research in Bangladesh that's actually showing that menstruation is not the main reason why they miss out on schools. There can be many other reasons why girls are kept at home. And it's also not always the case that they don't go because of facilities or because of lack of sanitary pads, which are often thrown in as the quick solution. I just spoke to somebody who did a dissertation in Uganda. She was like, oh, the issue is sanitary pads, which actually ended up being reason number 4 or 5 or 6 down the list. and the girls were mainly missing school because they had so much pain during their menstruation. So let's not jump to conclusions and work on the assumptions, but let's look for the evidence and what's really the case. The one thing that I want to throw into the group where I get uncomfortable is that within the wash sector we keep talking about menstruation hygiene management as if my period is something unhygienic. We like to talk about menstrual health. It's a health issue. It's part of life. It's nothing different. Why do we keep talking about it something unhygienic? That's what we like to throw in the group. Thank you.
Oh, that's a brilliant one. Thank you very much. And please keep throwing these difficult things in. Could we come back to Virginia, please? And perhaps Lizzie, could you help Hero when you take the catch box to take the little catch box as well? That would be great. Yeah, because you are being a hero, but you can rest. Virginia, and then we're going to come across here.
Hello, my name's Virginia Roth. I have been working in human rights to water and sanitation for many years. I'm currently an independent consultant predominantly working with sanitation and water for all, but other issues as well. And I'd just like to say, thank goodness, finally, someone's talking about prisons at World Water Week. This is an issue that was picked up by Katerina de Albuquerque in her reports back when she was doing country visits. And likewise, menstruation was identified as an issue by girls in going to school. Now, it's absolute. I think you're absolutely right. We cannot be talking about sanitary pads. We have to be talking about menstrual health. We have to be talking about the stigmas that are attached there. And so I've got 2 points on that. One is that I think we should not be imagining that women don't also suffer from thinking there are stigmas there. It's not just old grey-haired men that struggle to talk about menstruation. It's all of us. Yeah. And it's not just in developing countries that it's a problem. It's all over. There's also been studies in Scotland that have found similar problems. And just briefly on that, don't stereotype the Scots. They're about to save us from Brexit, we hope. So those are the two things that. And then the final point I wanted to make was, this is a deeply, deeply political issues that we're talking about here. And again, coming back to the human rights, we have a human rights framework. We should be using it, but absolutely understand that this is not going to be an easy road. I'm delighted this year the UN World Water Week is talking about leave no one behind. I don't know what the theme is for next year, but I'm worried, very worried, that these things, they're here this year. How do we make sure that they stay on the agenda right up until 2030? Because unless we keep the pressure on, we're not going to reach the goal of the Sustainable Development Goals.
Thank you very much. Thank you very much, Virginia. Thank you, Lucy. Please, gentlemen here, we'll work across behind, just right next to you. Yeah, thank you very much.
Great. Thank you very much. My name is Waltaji. I'm working with the WHO on environment and health. It was a nice presentation from the all colleagues there, and it has been raised. But I do have 2 points. One is we are talking about leaving no one behind, and then we are talking on different issues about prison, about menstrual hygiene. But I would like to highlight the social and the norm and the belief fabrics here. So countries are doing a very marvelous job in many things, but these is neglected. I call them is a neglected problem, because this is deep-rooted in the cultural and the social fabrics of the society. Even though maybe the facility is available, be it a latrine or a sanitary pad for menstrual hygiene, there is a deep-rooted belief and culture and norm attached to that. If unless otherwise we are going to change that deep-rooted belief and norms and culture, there is no way that we can go, even though we have going to bring the infrastructure. We have talked in such a kind of meeting, a very nice word in leaving no one behind. So I think I would like to hear from the presenter if they have worked around the social fabrics linked to this sanitation, whether it is a CLTS or the menstrual hygiene, whether they have looked at, while they are implementing the project, a given community social fabric and the beliefs attached to that. If we don't tackle that, it's very difficult. From the experience I have, I'm in the field for over 25 years in the water and the sanitation. I always find difficulties, the social fabric and the beliefs within the community. So this is what I want to highlight. Thank you.
Thank you very much. Come to this gentleman here, and I've seen you, so we'll come back to you, Madame, behind. Yeah.
Thank you very much. It is a wonderful discussion here. I'm very newborn baby in these cases, especially on MHM. Though I'm a academician, I'm a university teacher of Bangladesh Agriculture University. I became a father. I have a daughter. But particularly, this issue is very core issue. It is not like that a sanitation issue. It should be an independent issue. Because it is basic needs. It is human rights. All these things are included in here. Whenever I married, after that I learned these are the basic issues. Before that, I didn't know